presentation. Next, I'll call upon Dr. Seema Krishna for care and cure, how to protect the interests of patients.
Good morning, everyone. Here I am going to talk about much of the practical aspects, how we can handle patient in the OPD. So before a patient knows, we should know that what are the exact rights of the patient. They have all the rights. We need to inform them about the diagnosis, treatment options, risk and benefit associated with each option in a language which patient can understand. So it has to be properly conveyed to the patient, and as we know that we have to give the consent in a language where they understand it properly. Even for a minor medical procedure like we are removing the foreign body, it's not that we will put the paraffin. Even while putting the paraffin also, we have to inform that some drop is being put in, or even putting the Tropico Plus, all that has to be informed properly to the patient. And it is very important to keep the confidentiality about their illness, diagnosis and treatment, and it can be revealed only by the law if it is necessary. Otherwise it has to be kept confidential. And obviously if there is a female patient, there should be always a female healthcare provider for all the male doctors. And during even a OPD consultation, while we are performing any procedure, and all the patients should be treated respectfully regardless of the gender, race, religion or a social status. All patient has the right to choose that which healthcare provider he wants. If we have a center where multiple consultants are there, and if he asks for a particular consultant, then he should be shown to that consultant, and he can actively participate about the decision about his care. If we have a multiple option, then it has to be properly discussed with them. And if they want to seek a second opinion, then it is better to give them an option. In fact, if we are giving them a new treatment, or we see that they are in a doubt about our treatment, then if we by ourselves give them that you can go and show to some other consultant or some other specialist, they will feel more of trust on us. And obviously we have to give them a quality care. They have all the right to complain without the fear of retaliation. It is better to keep a complaint book, and it should be accessible to the patients, so they will feel that they are being properly treated. If any course of action is going wrong or anything, there has to be some person in your OPD, designated person, where the patient can go and lodge its complaint. We have to be properly communicating all our services. In case of whether we have to know whether the support services are offered in case of speech or vision impairment or language barriers. So it is like we see patients from different areas, so it is better if we give them some other options where we can help them with these language barriers. And in the right to transparency in transaction, if they ask for a receipt even for a minor procedures, we have to give them receipt in all cases. Right to pain management and transfer and continuity of care. Unless patient has been explained clearly why they are being shifted to the another ward or hospital, they have right to stay exactly wherever they are. And we have to be continuously seeing the patient, that if they are having a pain, like many of time what happens post cataract surgery, that everything is fine but they have a pain, then we have to treat. In the corneal ulcer also, we give all the antibiotic, all the antifungals, but we don't give a simple painkillers. Then it has to be properly given to the patient. But along with that, the patient responsibilities are very important. Providing accurate information about their medical history, their current health status and any medication. Obviously patient is not going to tell by themselves. We have to give some questions to them, but it is their right, their responsibility, that they should convey us all the information properly. and they should follow our instruction. We are not the God that if they see us they will be better. They have to follow our instruction, taking proper medication as prescribed, attending the appointments and following any. So this has to be told by us to them also, that you have to do all these things. So their responsibilities they won't understand, but we should convey them properly. And they have to respect healthcare providers, including all our staff, from the down workers to the up, from the verbal or physical. See, these are the things where we should limit them. If they are like becoming violent to us, and then there should be our attitude that this cannot be beared by us, and we have to be particular about them, and they have to take care of their personal belonging. We are not responsible for any loss of their belongings in our setup. And paying for services, yes, many time patient ask that last time आपका fee था 500, अभी 600 क्यों किया. So in that cases you have to take that tell that this is what service you are providing and you are taking charges for the service. It's not something like a bhaji market where they can do this. And this happen with many of the private practitioners, that you come down, that if they say okay last time you charge 500, then we say okay you give 500. No, you have to be at particular time that they should pay for your service. You are giving them a service. And then coming to the emergency care, yes, triage in ophthalmic care is also important when there are multiple casualty events happening near to your hospital, like where there is an immediate and light threatening things are happening. Your hospital should have SOP with the multi-speciality hospital. There should be a ambulance care or ambulance number with your hospital, so that you can refer this patient immediately to the nearest multi-speciality hospital. The triage too will include the treatment like which has to be attended within 10 minutes, like the chemical burn where you have to immediate give the wash. No treatment, first give the wash to the patient. Penetrating eye injury in CRAO where there is a sudden vision loss, severe eye pain, endophthalmitis, acute angle closure glaucoma, and the other treatments which can be dealt in within 30 minutes, like painless loss of vision like CRVO, total hyphema. Though we don't do so much of delay, but these are things which we should also know, because they are going to help you somewhere in the court of law. And the assessment within 60 minutes, within the 1 hour, like foreign body non-penetrating injury, painful red eye, flash burn, because it will have pain which is most delayed, and there is a sudden increase in flashes or floaters, especially with previous RD, small hyphema, blood in front of the chamber of the eye. So this is the triage system for the ophthalmic services, which many of us are not aware. And assessment and treatment can be done for 2 hours, like conjunctivitis, blepharitis, chalazion, dry eyes, long-term history of floaters. See, these are also the cases in private practice. We don't make them to sit 2 hours. Like in our practice, if any patient with the red eye, we deal it first, because these are the patient which will make a chaos and they feel that they are very emergency patient. But usually you can give them treatment within 2 hours. And when you are in OPD, it is better to flash somewhere that overall your ophthalmic treatment is going to take minimum 2 hours of treatment. So it will prevent you from many of the hyper patients. They want to be a very VIP treatment or something. The actual VIP patient are these vulnerable patients. They are in the specific group, like more than 80 years of age, less than 10 years of age kids. They are running from here and there. So physically and mentally challenged patients with complete or partial loss of the vision, comatose patient, usually they won't come to you, but in case they come to you, then, and thus patients with activities of daily, like they are unable to do the activities of daily living, limited physical mobility or impaired mental function, impaired communication or language problem, impaired bladder function. This is very important. The washroom facilities has to be accessible to these patients, pregnant women. So all these vulnerable patients, they should never be left alone. Some staff should be always continuously monitoring them. Tell your staff or give training to your staff. They have to be very patient with that these vulnerable patients. Their special requests should be always the wheelchair stretchers, these are very, very important because this is going to create some impact on how you are carefully handling them. And always mark V stands for very important or VIP patient, for fast service at each step. So these are the patient which you actually should attend them first. The child abduction, code pink, it is very important again, because in a busy OPD you may not be aware, but if all the children, their parents has to be continuously with them, they should take care of their children. But in case any child abduction happen, then all staff has to be alert, unusual behaviors, they can question anyone. There should not be any unauthorized person. So these things are very rare, but there is something called a code pink, and there you have to secure the entrances and exits, and every 5-minute announcement has to be done, similar like a code blue. Thank you for your